Is HoLEP safe for diabetic and heart patients? What do you need to know? One of the most common concerns I hear from patients and their family is, Doctor, my father has diabetes and heart disease. Is prostate surgery safe for him? Many patients delay treatment for years because of this fear. But the reality is that most men who need prostate surgery today they have medical conditions like diabetes, hypertension, and heart disease. So in this video, I'll explain whether HoLEP surgery is safe for diabetic and heart patients, why modern laser surgery is actually safer than the older procedures, and how do we evaluate the fitness for surgery, and what precautions are taken to ensure the safety of the patients. Why this question is so important? Prostate enlargement usually affects men after the age of 50. By this age, many men already have diabetes, high blood pressure, heart disease, and previous stents or bypass surgery. So avoiding surgery purely because of medical condition often leads to worsening of the medical problems, urinary problems, infections, and even kidney damage. The question is not whether the patient has medical problems. The real question is which surgery is safest for such patients. Now, how diabetes and heart disease affect surgery risk? Diabetes can affect wound healing and increase infection risk, while heart disease raises concerns about anesthesia, blood loss, and stress on the heart. In older surgical techniques, this risks were significant, like the open prostate surgery or even older endoscopic surgeries, which involve more bleeding, longer anesthesia time, and a longer hospital stay. This made surgery risky for patients with multiple comorbid conditions. Why HoLEP is different? HoLEP uses laser energy to remove prostate tissue. The laser sees blood vessel as it cuts, which means there is very minimal blood loss. This is a major advantage for patients with heart diseases, patients on blood thinners, and elderly patients. Because it is minimal, blood pressure remains stable during surgery and stress on heart is reduced. HoLEP is also performed through the urinary passage without any cuts, which reduces the infection risk, an important factor in diabetics. Anesthesia and pre-surgery assessment. Safety does not depend on surgery alone. It depends on the preparation for surgery. So before HoLEP, patients undergo optimal blood sugar control, cardiac evaluation, and anesthesia fitness. Many patients with heart stents or bypass surgery can safely undergo HoLEP with proper planning. Medications like blood thinner are managed carefully in coordination with the cardiologist. This team-based approach makes the surgery safe. Now, what studies and experience show? Multiple studies and real-world experience have shown that HoLEP is safe in high-risk patients. In fact, HoLEP is often preferred over other prostate surgeries in diabetics and heart patients because of many reasons. Few of them would be minimal bleeding, shorter anesthesia time, faster recovery, and lower infection risk. Many patients go home within 2 to 3 days. Now, what happens if surgery is delayed due to the fear? Delaying surgery because of fear can actually be more dangerous. Persistent obstruction can cause recurrent infection, sudden urine retention, kidney damage, and increased hospitalization. These complications put much greater strain on the heart and overall health than planned surgery. Timely intervention is often the safer option. Post-surgery recovery in diabetic and heart patients. The recovery after laser surgery is usually smooth, even in patients with medical conditions. Blood sugars are monitored closely. Early mobilization reduces the cardiac risk, and hospital stay is shorter, giving exposure to the infection to the minimum. Most patients resume normal activities very quickly. Take-home message. The most important message is having diabetes or heart disease does not automatically make prostate surgery unsafe. In fact, modern surgeries like HoLEP is specifically suited for high-risk patients when done by an experienced hand. Proper evaluation, teamwork, and timing make all the difference. Avoiding treatment out of fear can cause more harm than good. So make your decision wisely. And thanks for watching this. Do subscribe to my channel for more information. Thank you.